With the cost of healthcare continuing to rise and with qualified workers in short supply, the medical industry is turning more and more to robots to reduce costs and free up humans from the more routine medical tasks.
China just announced that they are actually going to be putting robots into their healthcare system because they're literally overwhelmed.
Like many countries, China's population is graying, and at the same time, they need so many healthcare professionals, they can't replace them fast enough to cover the healthcare needs for their population.
They're actually taking humanoids and they're using them within their healthcare system for their aged. So their nursing homes and other things, they're actually going to start putting robots into place instead of having humans help the human.
How concerning is that a humanoid is now responsible for your health care?
Well, from one point of view, it's actually not concerning at all. It's actually a good thing because robots don't get tired, they don't get scared, they don't get hungry. They're willing to do dull, dirty, dangerous jobs that humans aren't good at. So when you look at being able to take care of a human, then you've got a machine that doesn't mind being at your beck and call. Also, that machine can watch your vitals and other things a little bit more than a regular, say, a nurse or a doctor.
But there's a downside too. Unlike a real medical professional, a robot is all circuit boards and logic, and it has no effective way of dealing with a seriously ill person who needs someone to talk to, or for that matter, is dying.
Yeah, you got to have a little bit of empathy, right? You got to have a little bit of an ear to bend and be able to talk to that human a little bit different than than the normal robotic voice of get up, move, whatever it is.
A study by the National Bureau of Economic Research estimates robots in the medical industry could save between $200 and $360 billion in costs simply by automating tasks like dispensing medications, disinfecting hospital environments, and performing certain surgical procedures. All that, of course, reduces labor costs and could potentially shorten hospital stays. However, there's still a lot to work out with controlling a truly autonomous AI robot. Witness this viral video leaked to the internet of a Unitree H1 robot appearing to go berserk after a software glitch disrupted the robot's balance stabilization systems. Though the robot was not trying to kill its creators, it sparked a broader debate about how malfunctions like that could pose major problems in instances where reliability is critical, such as areas like robot-assisted surgery.
Part of the challenge, though, really is going to come down to, do we have the understanding of how to integrate these things correctly? And right now, we really just are struggling with that.
As we give medical robots more and more responsibility, we, as a society, have to ensure that there's a thoughtful approach in place, which will ensure that safety systems are there that inspire confidence in both patients as well as clinicians. Working for you, I'm the consumer guy, Steve Sprazier.